Well, good afternoon, everyone. We are glad to have you with us for today's mental health seminar. My name is Amy Johnson. I work in student affairs here at UNC Chapel Hill, and we're very pleased to be able to present another valuable conversation about the intersection between mental health and the various aspects of our lives. We appreciate your participation here today. Today's session is going to focus on mindfulness through art and contemplative practice. Since 2021, many of you who have attended one of these before may know that we have maintained a cadence of these seminars each semester during the academic year to maintain an intentional campus-wide conversation about mental health, with a goal to support our Carolina community through our current global mental health challenges and to give our faculty, staff, and students valuable tools to support themselves and each other. Each of these dialogues is led by a leader in our community who can help teach and guide us in a discussion through which we seek to build resilience, encourage help-seeking behaviors, and reduce stigma related to mental health. During the last several years, we have tackled a wide variety of mental health topics to consider and discuss the intersection between our mental health and well-being and other aspects of our lives, including topics like mental health and sleep, technology, grief and trauma, nutrition, relationships, and more. I'm really enthused about today's topic, as I think many of us wish we were more skilled in this area or have always wished for an opportunity to practice it more. This afternoon, we're going to explore the connection between mental health and mindfulness through art and contemplative practice. So I'm hopeful that today might open the door to that opportunity and help us step through it. During the seminar, we'll consider the intersection between creativity and well-being, led by our wonderful faculty member and administrative colleague, Dr. Cheryl Woods Giscombe, to discover how art can be used as an embedded, mindful practice to facilitate reflection and presence. We'll cover a combination of research-based insights with hands-on approaches designed to boost focus, manage stress, and restore energy. We'll discuss how art and contemplative practices are being integrated into healthcare, education, and community settings using culturally relevant approaches, and we'll discover and address some strategies that both you and your community may use for continued practice. So before I introduce our facilitator, I have a few notes to help ensure that we have a successful seminar today. The chat function is enabled for participants to communicate with each other and with our production team. The Q&A function is also live, which is how we ask participants to submit questions for the presenter so we can help facilitate the conversation and keep track of questions more easily. Please know that anonymous questions are allowed and participants can see all questions, including the unanswered ones, and can upvote any questions they also are interested in. Our facilitator will answer questions at the end of the presentation today. And if you are interested in CLE credit, the QR code will be displayed at the end of the seminar. So I am very pleased, as noted, to introduce and welcome our facilitator today, Dr. Cheryl Woods Giscombe, who is the Senior Associate Dean and Chief Wellness Officer and Levine Family Distinguished Professor of Quality of Life, Health Promotion, and Wellness in the UNC School of Nursing. She also has a secondary faculty appointment in the Department of Social Medicine at the UNC School of Medicine. Dr. Giscombe is nationally recognized for her research and leadership in stress management, mindfulness, and culturally relevant health interventions. She has developed innovative approaches to integrating contemplative practices, such as mindfulness and art-based reflection, into healthcare, education, and community settings. Through her scholarship and practice, she empowers individuals and organizations to foster resilience, well-being, and holistic health. Dr. Giscombe completed her BA in psychology from North Carolina Central University and a BSN from Stony Brook University in New York. She earned her master's and PhD degrees in social and health psychology from Stony Brook University, as well as her MSN and postdoc right here at UNC Chapel Hill. Cheryl, we are so grateful to have you here today with us to lead us in this discussion, and we are ready for your motivation and inspiration. I will turn the Zoom room over to you. Oh, Cheryl, I think you're muted. Do you have?
There we go. Is
There
that
we
better?
go.
Okay, thank you so much. It's wonderful to be here with all of you today. It's nice always to come together with the Carolina community, and I'm excited for what we'll be discussing today. And I think you can see my slides now. Is that the case? Okay, wonderful. So, as indicated on my slides, the title of the presentation is Mindfulness through Art and Contemplative Practice. I'm excited to be here as a Senior Associate Dean and Chief Wellness Officer in the School of Nursing. And we're just going to jump right in. We'll have some experiential time during the presentation and also time for Q&A at the end, but we'll be watching the chat as well. So this can be an engaging experience for everyone. Okay. Okay, so before I begin, I just really want to acknowledge some of the people who supported me to be able to share this content with you. And you can see their names listed below. They are members of the Josiah Macy Foundation, Macy Faculty Scholars, and or the Harvard Macy Art Museum-based education program for health professions educators. And so you see images here from the Museum of Fine Arts in Boston, where that training takes place. I'd like to start by telling you a little bit about the Office of Wellbeing in the School of Nursing. This is an image of our Levine Wellness Advisory Committee. The Office of Wellbeing was established last year in 2004, but was developed to enhance the programming we already had as the Levine Wellness Program in the School of Nursing, where alumni from our School of Nursing have contributed funds, particularly the Melissa Levine family, to support well-being for faculty, staff, and students. We now have an office that delivers programming, education, and also research projects related to improving well-being among clinicians and nurses in particular, but also our programming specifically addresses the well-being needs of our faculty, staff, and students. You can see a list of our Wellness Advisory Committee members. We are excited that we use a conceptual framework to guide our work. This is the framework by Roy's. It is called Collective Wellbeing, and Roy's framework from Yale University, but it was based on research that found that connectedness, vitality, inspiration, opportunity, and contribution are key elements of collective well-being, particularly in workplace settings. If you're interested in knowing more about this framework, the article is cited here by Brita Roy and her colleagues, the literature review, which informed the framework. We're also excited, and maybe you will be too, because there's not one person who's not touched by the healthcare workforce. But this topic of collective well-being, well-being among clinicians, but also well-being in workplace settings is critically important for the well-being of nurses, physicians, all kinds of other healthcare professionals and educators. And so there are a lot of different initiatives that guide the work that we do in our School of Nursing, but also across the nation. And I think these slides will be shared, but these are just examples of a number of initiatives that support workplace well-being and also clinician well-being. Another underlying framework that guides our work was developed by the team of our immediate past U.S. Surgeon General, Vivek Murthy. And the call to action that the Surgeon General had at the time included 5 essentials for workplace mental health and well-being. And those include protection from harm, connection and community, which we're here doing today, work-life harmony, mattering at work, and opportunities for growth. So I usually pose this as a question. Can individual wellness influence institutional wellness and success? But I want to say it more definitively to help you be really clear on the angle I'm taking today. And it's to say definitively, individual wellness can influence institutional wellness and success. So many times we think about different programs or even interventions that are individually based when we know that some of the challenges we face with mental health or well-being more broadly are institutional or at a structural level. But structures and institutions are made up of individuals. And so the more we can do to support individuals and also to support teams of individuals, units, schools, departments at UNC, and also this can spread beyond UNC. We can create an environment that's more healthy and resilient and well. And this is just an example of the socio-ecological framework that probably many of you are familiar with, but the individual sits in several layers of systems that lead out to society and community. And so all of those levels are important. Today, we're focusing on individual well-being and how our own individual well-being can promote the well-being of working groups, units, departments, teams, etc. So, specifically today, we're going to talk about the potential benefits of mindfulness and art-based contemplative practice. We'll ask ourselves, and I think by the end of today, we'll be able to state what are the potential benefits of mind body self awareness, compassion, and art based contemplative practice. My research, which has been funded by several different entities, focuses mostly on stress, coping, mental health, and the mechanisms of stress that influence chronic illness. One of the studies that we recently completed integrated the elements of some of what we'll be talking about today. It was called the Harmony Study, and it was a mindfulness-based behavioral lifestyle intervention integrating mindfulness with education on healthy eating and physical activity to help reduce cardiometabolic risk in a group of people that have a high risk for cardiometabolic illness, mortality, morbidity, and mortality, and that's African American women. So the Harmony study is our most recent clinical trial for our research team that included mindfulness, and we'll talk a little bit more about how mindfulness works. There have been, I would say, 3 to 4 now decades of growing research, more rigorous research. Some of the foundational studies are cited here, but we have all kinds of literature reviews and systematic reviews and clinical trials that have more recently demonstrated the benefits of mindfulness and mind body interventions for physical health and mental health, and for just all types of health for individuals, families, and communities. And on this slide, you can see some of the outcomes that have been have benefited positively from mindfulness-based interventions. So there are outcomes related to type 2 diabetes, blood pressure, binge eating, sleep quality and quantity, even pain, chronic pain, such as chronic low back pain, fibromyalgia, rheumatoid arthritis, irritable bowel syndrome, cancer symptoms, coronary artery disease, as well as mental health conditions such as stress, social anxiety, depressive symptoms, chronic worrying, and you can just see the list here, family well-being, prenatal stress, relationship strain. These are some of the outcomes that researchers have examined to see how mindfulness and mindfulness-based stress management or stress reduction can improve symptoms or outcomes related to these conditions. And a growing body of research has shown support for this. So, mindfulness and self compassion, as we've just mentioned, have been linked to reductions in things like anxiety, burnout, and cultivating self compassion resilience. Mindfulness and self compassion training and practice are increasingly used in clinical care. In fact, here at UNC Chapel Hill, we have a Office of Mindfulness, a program on integrative medicine, and a mindfulness program that's been long-standing in the School of Medicine. A large and growing percentage of people in the United States and worldwide are utilizing these techniques and practices as tools for enhancing wellness in today's highly stressed world. So let's back up a bit. What is mindfulness? One definition of mindfulness by Dr. John Kabat-Zinn is included here. Mindfulness is the intentional self-regulation of attention to present moment experiences. So, what's happening right here, right now in the present? Elements of mindfulness include paying attention on purpose in the present moment without judgment, but with discernment, but in the service of self-understanding and wisdom, which leads to serving others. Another definition of mindfulness by Dr. John Kabat-Zinn emphasizes that the word for mind and the word for heart are the same. So if you're not hearing mindfulness in some deep way as heartfulness, you're not really understanding it. Compassion and kindness towards oneself are intrinsically woven into mindfulness. You could think of mindfulness as wise and affectionate attention. So, a little bit more about mindfulness. There are seven pillars of mindfulness. Those include non judging. So, that's the non judgmental present moment awareness. So, being with whatever arises in a kind and gentle way. Patience, so not feeling overly judgmental of yourself or wanting a quick response or reaction, but being patient and allowing your mind to be connected to your breath and the sensation of your body, which develops over time. Another key concept or pillar of mindfulness is beginner's mind, approaching each meditation or mindfulness experience as if it were your first time. So you can think of beginner's mind, you can think of a toddler walking down the sidewalk with one of their parents, and the parent is rushing off to work or to an appointment or to a play date, and that toddler sees a wildflower on the edge of the sidewalk, and their parent is holding their hand, but the toddler wants to stop and look at the flower, even pick up the flower, smell the flower, blow the flower, and the parent wants to say, "Come on, we're going to be late." But the toddler is in the present moment. They're right there in the present, recognizing and sensing what's around them. So that's an example of beginner's mind. Another example of beginner's mind is approaching a situation that you've experienced many times as if it's the first time you've ever experienced it. So we'll talk a lot about that today. Trusting in your own experiences, feelings, and intuition. So developing wisdom. Non-striving, so not straining or forcing for a particular result, like, okay, I'm going to be mindful, or I'm going to meditate, or I'm going to have some self-care time, and I expect it to be peaceful. I expect myself to feel calm. Hopefully, those things happen, maybe, but being present with what does arise, because it may be a pathway towards getting to where you want to be emotionally. Accepting yourself as you are. Sometimes, many times, we are our own worst critics. So, acceptance, letting go, or cultivating the attitude of letting go or non-attachment. So, you may think, well, attachment, isn't that a good thing? And yes, it can be, but sometimes distress can be defined as when your expectations don't match reality. And many times we may go into a situation and we're already having all these expectations for it. So that's a form of attachment because maybe last time you had that experience, it was wonderful. You can think about, we just had the state fair, right? And many of us grew up going to the state fair and it made us full of awe and it was so joyful and we just had a great time. And so then the next time we go, we're expecting those same feelings, but then maybe it's a rainy day, maybe it's cold, maybe it's hot. Maybe your favorite ride is broken. Maybe they don't have your candied apples exactly the way they used to taste. So then that means the expectations and reality don't match, and then that can lead to distress. But letting go is also related to that sense of beginner's mind. Yes, you went to the state fair last year and it was wonderful, but then being curious about, well, what's going to happen this year? It may not be like last year, or this event may not be like last week. What is here for me today? Okay. So, in mindfulness, which I imagine many people on this call are either practitioners or you've been exposed to it in some way, so this is not new for you. But there's some formal mindfulness practices and informal mindfulness practices. So, some of the formal mindfulness practices include sitting meditation, which involves a focus on our breath, and you can sit for 2 minutes, 5 minutes, 40 minutes. And it's where you experience a commitment to whatever time period that is. You're allowing yourself to be in the present moment. So, not worried about the past or what happened last week or yesterday or even a few hours ago, not being anxious about the future, but being present with the now, recognizing that our minds think and they might even worry, but then allowing yourself to bring your awareness back to your breath. So that's sitting meditation. Body scan meditation includes being attentive to body sensations in a very intentional way. Mindful movement is like yoga, walking, or gentle stretching with present moment awareness and intention. And there's also a practice that's formal called loving kindness meditation, which is a set of steps to help generate self-compassion and compassion for others. There are also informal mindfulness-based practices. That's where you can bring mindful awareness, so that non-judgmental present moment awareness, to any activity that you do during the day. You could practice mindful eating, where you're not on your phone while you're eating, you're not watching TV, you're not even talking. You are just with like the food that you're eating, you're sensing, you're chewing, you're swallowing the taste of the food. You might even be giving gratitude for those who made the food, those who prepared the food. So, in our courses where we teach mindfulness, we may suggest that people eat an entire meal mindfully, or they just eat the first few bites of the meal mindfully. And people really recognize how much they're more able to taste the food, appreciate the food, and notice when they're full, and maybe eat less. I mean, there's just different ways that my eating mindfully has an impact on people. Then there's also an informal practice of being just aware of events during the course of your day. So say you're walking across the quad at Carolina and you're noticing the blue sky, or you're noticing the leaves have changed colors and they're the fall colors, or you're noticing the squirrel running across with acorns in its mouth. And those are, awareness of an event. And then you also aware about the pleasant influence of that. But if you're not a squirrel person, you might not like a squirrel running across your path. And so that may be awareness of an unpleasant situation, but it's just another way of bringing awareness. Many times we're in the past or in the future or worrying, busy in our minds. And so the more we're aware of the present moment, it's just like building a muscle of that present moment awareness. And then similarly, mindfulness of everyday life. So we can even bring mindfulness to when we're washing our hands before our meal, or dishwashing, or anything that might feel like a task we don't want to do. We can be aware and kind of allow that to be a present moment experience. So, a lot of the mechanisms of mindfulness that influence its benefits on chronic health conditions that I showed you on the list before have to do with the stress response. So, stress is inevitable. All of us experience stress in our lives. Stress can be good sometimes because it's motivating, but stress can also be what we call distressing, meaning that it's making us worry or making us have negative emotions. Um, there's something called acute stress. So those are acute stressors or events that happen once or twice, and they are like cause us to activate that fight, or cause our bodies to activate the flight or fight response. Then there's chronic stress, where we're experiencing the same stressor over time. So that may be like caregiving for a sick family member. It could be where you are having financial stress, or just something that's not just once or twice, where it's just something consistent. And so, with acute stress, as I mentioned, our brain and our hypothalamic pituitary adrenal axis system activates, and our body is designed to try to get away from that stressor, because our bodies are designed to survive, right? We're not designed to be burden. We're designed to try to survive and get away from things that are risky or dangerous. So our bodies are very brilliant and wise, and they activate so that we can get away. And so that's a good thing to help us survive. But if we experience stress chronically, day after day after day, then that system that's meant to help us survive can have a negative impact. And you can see here from this image of some of the body's systems. And when you remember from probably basic biology, we have an autonomic nervous system. Our body's meant to be balanced. So we have that fight or flight, which is like the sympathetic nervous system response, where our bodies are prepared to get away or to just be very responsive in a survival type way. So our pupils dilate. We don't have as much salivation. You can see this on the right side of the image. Our bronchi relax, our lungs relax so we can get more oxygen so we can run. Our heart rate increases. We're not in the mode of digesting food because our energy needs to go to our muscles so we can run, those large muscles in our legs or our arms to fight. Um, we have release of hormones like epinephrine. Our bladder is relaxed. There's all kinds of different things that happen, even our reproductive organs. So that's good in the short term because we're, again, trying to get away from harm or trying to be responsive to harm in ways that will make us survive. And then our body balances that out through our parasympathetic nervous system. So our body then stimulates salivation. We can now digest food. The heart rate relaxes. So things like yoga and stretching or breathing allows that parasympathetic nervous system to be more active. When I say breathing, I mean we're always breathing, but intentional slow breaths or just intentional calm breaths. And so, when we are acutely stressed, we might have constipation, we might have indigestion, but then our body relaxes, hopefully, once that stressor we've gotten away. But if we're experiencing that chronic stress, our body starts, our systems start being challenged, and we're at higher risk for things like cardiovascular disease, diabetes, and autoimmune conditions. And so, mindfulness practices, even what I described earlier, even those everyday mindfulness practices, allow us to activate that parasympathetic response that allows our body to calm down and not be so activated. Okay. Think we're going to go on. So, mindfulness cultivates presence. I think now I know why I have these slides. So, a lot of my research here that's been sponsored by these entities, including that Harmony study, focus on that stress response system and trying to interrupt it through teaching people about mindfulness and stress management and also the sources of stress in their lives so they can reduce their risk for those stress related chronic health conditions. Mindfulness also cultivates what we call heartfulness. So, with those seven pillars of mindfulness, non-judgmental, acceptance, patience, openness, letting go, and you can start to realize that it's not just beneficial for stress-related physiological changes, but relational benefits, communication, problem solving, proactiveness, resisting reaction, as they say, but being more responsive with thoughtfulness. So, mindfulness can lead to enhanced self awareness, increased insight, increased flexibility, empathy, gratitude, compassion, and it also can help us be more prepared to engage in healthy, courageous communication. I'm going to pause here to make sure you can still see my slides. Okay, great. Excellent. So this is where our session today comes into play. So we're going to talk not just about mindfulness in the traditional ways that people often think about in terms of meditation practices such as sitting meditation or breath work, but we're going to talk about other practices, art-based practices that can also help us achieve similar results. We're going to talk mostly about visual arts or art that's in museums, but there are other types of art-based contemplative practices that you may want to integrate, and we can conclude with that at the end. And when we say art, we're talking very broadly. Photography, any types of images or pictures, to more formal types of art in museums. So now's your time to take a pause from hearing me speak and just take a look at this image and engage with this image. So when you're ready, if you are willing to share in the chat What words and feelings come to mind when you observe this scene? Okay, we're starting to see some chat responses. And let me preface, I didn't preface, but let me go back and preface. For all the experiences we're going to have from now on, just know there are no right or wrong answers, right? You're going to see a diversity of answers because everyone experiences things differently, and that's what makes us unique. So for some people on this seminar, in this seminar, um, what came to you is peace, calm, quiet, serenity, beauty, relax, scent, lavender, serene. Okay. Thank you for sharing that. Now we're going to go. Well, the next question is, what do you notice about your body? So, what words come to mind? And then you might even notice with non-judgmental, present moment awareness, what's going on in your body as you're being with this scene. And you can add those to the chat if you haven't already. And some of you had already mentioned calmness, serenity. We've got a few more, relaxation. Thank you. So my next question for you all is, do you typically carry the feelings generated by this image with you? And you don't have to answer, okay? You don't have to put it in the chat, but you can think to yourself, do you typically carry the feelings generated by this image with you in your professional life? So you all mentioned some of you who, and there may have been some who felt differently that didn't put in the chat, but those that put comments in the chat, you mentioned peace, calm, quiet, serenity, serene, crisp air, calmness. And so when I ask, do you typically carry the feelings generated by this image with you in your professional life or at work? Um, do those feelings, do they reside with you at work? And when I ask this question in meetings that aren't being recorded or where people can answer anonymously, many times they say no. And so hopefully, after the end of this session, we may figure out ways that we can experience more of this at work, even when we're in the midst of challenging experiences. Okay, so we're getting ready to go into our first art-based practice. I'm going to show you an image that's probably familiar to you, but I'm inviting you to bring a beginner's mind to this image. And I'm going to invite you to bring a sense of mindfulness to this image. So even before I show it, hopefully this first image allowed you to be a little bit more present, a little bit more parasympathetically influenced. And so before you start answering the questions that are on the next screen, I would like you to just spend a few moments with the image, with a beginner's mind. Okay? This is our first formal art museum-based practice. Okay, let's spend a few moments with this image as if we've never seen it before, taking it in with presence. Okay, so there's a practice called visual thinking strategies. And it's also referred to by a number of museum educators as close looking. And close looking, or VTS, visual thinking strategies, which is an evidence-based approach, has three major questions. So generally, a group of people, and we're the group today, the 46 of us plus, would be in an art museum. We might be at the Acklin, or we're in France, right? Seeing this real picture, right? This real piece of art, and we're gathered around it, and we're being asked to just stand and engage with it, and just take a look at it as if we've never seen it before. And then we get to ask one of the members of our group to volunteer to answer the first question, which is what's going on in this picture? And so at this time, I invite any of you to share what's going on in this picture in the chat. Not necessarily what's the name of this picture, right? But what is our experience of this picture, this image? I'll give you a few moments to share your perspective. Okay. I know it takes a while to type, so we gave some time, which is good because it allows other people to be thinking for themselves what's going on in this picture. So we'll go with the first person who responded, Kendall. Kendall says, this picture makes me think about the past. I feel like I've seen it so many times throughout my life that it really makes me look back onto my past. Okay, so thank you, Kendall. So if we were in the museum, and we even do this virtually, so we are in the museum together virtually. The next question I would ask, I would stay with Kendall, and thank you for offering your response, Kendall. And I would ask Kendall to a bit more. I'd say, okay, Kendall's saying that this picture makes her think about her past. She's seen it so many times, it makes her think about and look back on her past. And I would then say, what do you see that makes you say that? And Kendall, it's up to you if you want to respond to that or not. I don't want to make you feel picked on, but that would be the next question. What do you see that makes you say that? So what do you see in the image? And Kendall might respond in the chat, but I'm going to give you an example along the way. So it's possible that Kendall will say, well, I see, and she's kind of already said some of it in her first response. I've seen it so many times. And so I'm just thinking about all the times I've seen it before. And then it's possible that in the museum experience, some Kendall might say, or the person may say, and I've seen it so many times before, and it's reminded me of my past. And I'm also noticing her attire. Her attire even reminds me of her past. So she may start to look at aspects of detail in the image. And then we'd say, what more can we find? And so then we go to Angie, and Angie said, relating to the patients, it would take to sit still for a portrait, right? So Angie in the comments is saying that she's noticing that this person must be sitting still and being patient to sit still for this portrait. Then I would say, as the facilitator, what do you see that makes you say she's sitting still? So I'm taking the perspective of the participant, and I'm trying to go a little deeper about what they see. And she may say, well, it's her posture. Like looks like she's sitting upright in a chair. And then I'm also noticing what's behind her. I'm not sure if that's really mountains and streams and maybe even a river or a bridge in the background. But that background is making me think there's an artificial background behind her, and she's sitting in a chair for a portrait. And then I would ask the next person, I'd say thank you to Angie and also thank you to Kendall. But then I'd say, what more can we find? Acknowledging what they saw or what they felt when they saw the image. But then, and what else is there? What else is there for us? So we're bringing curiosity. And so someone might say, I can't stop looking at her hands. They're really interesting to me, how she has her hands crossed. I'm not sure if her hands are red or if that's just the coloring of the image, but I've never really noticed, how her hands are shaped and how they're crossed, and that's really intriguing to me. And then I'd say, what do you see that makes you say that they're red? And she'd say, well, the person might say, well, they're different color tone than her neck. So I hope you are following that with each person that answers the question in the group, what's going on in this picture? There's an opportunity for all of us to look more deeply at an image we've seen so many times. Maybe we're even noticing something about this image that we never noticed before. Like someone might be noticing, wow, like I never noticed that on one side of her hair, it's kind of curly. I mean, just anything. It's not even not that it's meaningful per se, but we're being present. We're having engagement with the image, and we're not really focusing on anything else right now but the image. So it gives an opportunity to be present and have that same present moment awareness that other forms of mindfulness or meditation may have. Okay. Any other comments about this picture before we go to the next slide? Okay, gonna go to the next slide. So that was an art museum based practice, and I'm going to tell you a little bit more about it, and then we're going to experience it with images that may not be as familiar. So visual thinking strategies is a practice that is grounded in the fine arts and humanities disciplines, based on research by psychologists and educator scholars. The trained facilitators who lead VTS receive lots of training, and they're there to guide group processes of understanding art using those three open-ended sequential questions. What's going on in this picture? What do you see that makes you say that? And what more can we find? Research on VTS shows that it can strengthen communication because we're asked to be more expressive and to really think about what we're saying and what we're seeing. Team building, and I'll ask you all a bit later about why you think it might increase team building. Self-awareness, awareness of bias and assumption, and awareness and appreciation for the perspectives of others. So we'll come back around to the how in a second. So, visual thinking strategies can be powerful because art is really a wonderful vehicle for telling a human story. It can promote empathy and understanding. It can reveal information about people's social context. And close looking at art can highlight the power of attending to details. VTS reveals that the eye sees what the mind already knows. So, what that means is oftentimes when we see an image, we see what is already resonating with our current belief system or our current context. But the more we hear from our colleagues about what they see, it opens us to seeing things we wouldn't normally see. And that can help with all kinds of things in terms of team building and communication, but also our own well-being. So let's go to this one. This one may or may not be familiar, um, but let me ask you the same question. I'm going to give you time. I'm going to ask us all to be patient, for people to put in the chat what is going on in this image. There's not any right or wrong answers. And sometimes you may need to take um, a few moments just to engage with it. And when you decide to add content to the chat, you don't have to put what everything that's going on in this picture, but what's standing out for you. Maybe one thing. Noticing even how you're feeling as you're taking it in, as you're looking at it. Some of you may thinking, wow, there's so much going on in this image. Not sure what to focus on. Okay. Okay. So thank you, Sarah. Sarah says, to me, it's a visual of the power of music as connection. So Sarah, I'm gonna stay with you for a little bit, okay? And I'm gonna go to the second question. What do you see that makes you say that? We'll give Sarah time to type and others can continue engaging because it's possible that you're seeing something else that's going on in this picture. But we're excited to hear about what Sarah sees that makes her say that. Okay. Sarah mentions that I first noticed the two people looking into each other's eyes. Okay, so if we were together physically in the art museum, then I'd be pointing at what Sarah's saying. So she noticed, let me do it over here. She noticed the two people looking at each other, looking into each other's eyes. And then she got stuck on the guy on the right, seeing into his mind. The guy on the right, seeing into his mind. And there's an open door with a woman coming through it, possibly the woman across from him. Wow, interesting. Thank you, Sarah. And so Sarah is helping us to see her perspective of how the power of music as connection, and the two individuals looking at each other, and then looking into his mind, the image of the woman in the doorway, and that it may be this woman. Thank you. So I could stay with Sarah and I could say, what do you see that makes you say that it's possibly the woman across from him? Or I could just go to the next person and say, what more can we find? So perhaps one of you on the Zoom call is, seeing what Sarah described, but you're also noticing what Sarah described is maybe different than what you saw. And perhaps you're willing to share it in the chat. What is happening in this image? No right or wrong answers. I'm going to be patient and give time for at least one more person to respond. We can all continue to just engage and allow ourselves to be present with this image. What is happening, or what is going on in this image? I'll give you a few more moments. And then maybe I'll share what we have heard from others, previous experiences of this image. Okay, somebody has responded. Okay, Angie, thank you for your response, Angie. Angie is saying, I see a goblet in between the faces. And I had to flip it upside down for that to form. So Angie is saying she sees a goblet. I'm trying to use my mouse. I hope you all see it. And then she said, oh, maybe it's a candle holder, but I see something between their faces, a goblet or a candle holder. And then I could say to Angie, thank you, Angie, what do you see that makes you say that? Um, and then she'd tell me, and then I'd say, what more can we find? I mean, we could spend 8 hours with this picture, with what more could we find? If we're willing to say, we don't have anything else to do today. We can just suspend all other things and be with this picture and just let our minds experience some creativity. But we know we don't have all day. So I'm just going to point out a couple of things. Both Angie and Sarah pointed out some common, and not to say you're common, but that these are common things people see in terms of the two people, the eyes, the candle. People, if the more time they spend, they will see this candle or goblet, and then the image here. Some people initially see a woman sitting here with a hat on or a basket on her head. Um, or a man here with a string instrument. So they see maybe an elderly woman's face and an elderly man's face, but others might see a woman and a man here. And then they might see a bottle here. Is like that her earring or is that a glass bottle? I don't think I've ever heard anyone mention that this might be her in younger years. That's really interesting. So it's all kinds of things people might then bring their attention to what's happening in the background. What is this shared blanket that they're wearing over their shoulders? So the point is, again, not to be right or wrong or to come up with more things than others. It's for us to recognize that there's a lot going on in this picture. There's not one truth of what's going on in this picture. There are multiple perspectives. And the more we hear from our colleagues about what they see, the broader our perspective gets. And we see more because our colleagues help us see more if we allow them to do that. So we have our perspective, and other people's perspectives can be completely different, but they're just as real. Okay, I'm going to go to another one. I'm going to check the time. Okay. So we'll ask the same three questions for this image. So first I'm going to give you all a few moments just to take it in. So just allow yourselves to, we're in the museum, we're standing, this piece of art is in front of us, and we're just noticing. And of course, when you have a few moments to notice, I'm going to ask someone to volunteer or people to volunteer by saying what comes to mind, by what's going on in this picture. One thing, it doesn't have to be everything, but what's going on. Oh, sorry. It changed on my screen, but not yours. Okay, there we go. So what's going on in this picture? But first, just take a few moments with it. And as we're experiencing these images and just this session in general, we can even be asking ourselves, how often do we allow ourselves time just to be and to take things in, and be present? It may seem sometimes like we don't have time to do that, but the potential benefits of it may be pretty high. So I'm going to kind of walk us through this one based on experiences I've had leading groups with this image in the past. Sometimes when we ask the question, what's going on in this picture, many times people go directly to this part of the image. They may say, oh, I see a mother caring for her daughter. And I notice some aspect of nature, leaves, and perhaps that's got some kind of healing property. And so then I may say, what do you see that makes you say it's a mother and a daughter? Or I may say, what do you see that makes you say that their leaves have some kind of healing property? And so then that leads to a cascade of other people responding when I ask, what more can we find? People might know, I mean, they notice all kinds of things that help other people notice what's going on in the picture too. So someone may notice, oh, I see a sewing machine, and maybe this person is a seamstress, and the pink outfit here in the corner may be something she recently sewed, or maybe she just recently went somewhere because there's also a purse. Or someone may say, I noticed the leaves in her hand are similar to the leaves in the tree outside the window. Or spirituality or religion is really important to this family because, and I'll say, what do you see that makes you say that? And they'll point to the images on the wall or on the dresser. Some people may say natural healing remedies are really important in this family because I see like the humidifier, but then I also see that they have medication that looks a little bit more traditional over here on the counter. I mean, there's so many things. Most of the time, people will say, oh, there's a little boy looking at his grandmother taking care of his mother. So then we'll say, well, what do you see that makes you say little boy? Then that leads to all kinds of conversations where people say, well, actually, he looks like a little man. Is he a little boy? And what does that represent? And so then that leads to people saying, well, maybe he is a man, and but seeing this scene is making him feel vulnerable like a young child. And so then the image of him is little. I mean, and there's just all kinds of things. And thank you, Jesse. I appreciate your comment. So the point of it is just engagement together and like seeing what we see, feeling what's coming up for us, but also seeing what other people see, and then helping us almost like a puzzle that people's perspectives help us to complete a puzzle. So, how do we apply this to to life, right? To our lived experiences? So VTS helps us to consider the difference between seeing and observing. So maybe if we were busy and we just walked by a room or a wall with a piece of artwork on it, we just see it, right? Because we're not in the present moment mode, right? We're doing something else. But observing is where we intentionally take the time to take it in. And there are faculty members at UNC that take students to the Ackland Museum or do these visual thinking strategies, particularly in pathophysiology classes or health assessment classes, if it's, say, a medical student class or a nursing student class, because they want to help those students be able to be a little bit better at observing. So they're not just seeing things, they're knowing how to be more present for the benefit of the patients they're going to care for. But art can also help us become aware of what we call heuristics. or cognitive shortcuts, also known as schemata. So, cognitive shortcuts basically are helpful to us. Cognitive shortcuts meaning mental shortcuts, like where we are not seeing all those details that are in the work of art. We're just seeing, oh, that's a mother taking care of her daughter, and there's a lot going on, but we're not taking the time to like really look and understand what the values are to that family. Or we saw that very first image that was familiar to us, and we're like, that's the Mona Lisa, and that's that. We're not really taking in the details of it. So, what factors in our lives cause us to rely more heavily on what we call pattern recognition, where we see something, we name it, and we go on, right? And most of the time, it's busyness. We're busy, we have to be productive, we have things to produce, we need to go on with our day so we can go home from work. So, we don't really have a lot of time to observe. But the more we take time to practice this by through art or through music or through meditation, it doesn't take as long for us to get into that mode, and we're able to be more observant and more contextual, even in a moment. Okay, so I'm going to skip to the next slide. Who is this an image of? I would ask someone to put in the chat. I might be stating my age, but I think yes, okay, Maria and Robin, maybe we're about the same age. I'm older than I look. So yes, Angie, also Sherlock Holmes. And what does Sherlock Holmes have to do with all of this that we're talking about today? So there are lots of Sherlock Holmes quotes. You can even like go online and just Sherlock Holmes quotes, a fictional character, of course, not a real person. But Sherlock Holmes was known for seeing things that other people don't see. And that's what made him a great investigator, right? It made him solve crimes, solve problems. But it wasn't because there was something magical about Sherlock Holmes' ability to be observant. He trained himself to notice what he sees or to observe. And many of us overlook details just because we haven't trained ourselves to see that. But some people don't want to see details. It can be overwhelming. We don't have time to see all that. We just give us the simple thing, give us the short form of the story, give us the short form of your explanation so we can move on. Because seeing more adds complexity, but it's the complexity that makes us understand our team members, maybe be better proactive problem solvers, etc. So I'm going to give an example. So I used the word before heuristic, cognitive shortcut. It consists of preferences that help us decide in a situation what to do or what decision to make when we don't have enough information or don't care enough to make an informed decision. So, for example, when you want to go in the store and buy some yogurt, for example, you might decide on which yogurt you buy by the familiarity of the labeling or the brand name. Like you know what color it is. This is called a familiarity heuristic. And so you just choose it because it's what you're familiar with. And so we can think about the times in our lives when we choose things because they're familiar and not really give ourselves an opportunity to try something or consider something new. Similarly, schemata and heuristics are similar, but imagine we're going to the grocery store to get some laundry detergent. And we already know what kind of laundry detergent we prefer, right? We know what color it is. We don't even have to read the labels. We just go in, we go to the aisle, we pick it up, and it makes our lives what easier. It saves time. We have this schemata built in. And so that's helpful in terms of efficiency in our lives. But there are opportunities that we might miss out on when we apply that when it's not as helpful. So, again, VTS, visual thinking strategies, that close looking, asking ourselves, what's going on here? What do I see that makes me say that? And what more can I find? Helps us do something called readmit information that we would have previously filtered out because it's overly sensory or it's just complex. It allows us to attend to nuances and details, and it's similar to the concept of beginner's mind that I described in meditation, where we're seeing things like we might see something and say, oh, yes, that's a butterfly. But we look closer and then we're able to say more details about what kind of butterfly it is. So being able to make quick decisions is important and it lends itself to our survival, but it may also cause us to miss out on details that help us make more informed decisions or have more compassion towards others, etc. So I'm not going to go really deeply into this slide, but this Chapman person is one of our colleagues, Mimi Chapman, in the School of Social Work, who does a lot of this work with her students, art museum-based experiences to help her social work students think a little bit more broadly and deeply. But we basically just want to be more aware of when we're looking or seeing versus observing. So I want to just show you some other examples of pictures. We're not going to do the exercise with these pictures per se, but there's some images that I've used in previous presentations that really resonate with people when they're asked those three questions. What's going on in this picture? What do you see that makes you say that? What more can we find? And it allows us to really apply humanistic approaches also to what we see on a daily basis of people's lived experiences. So that image I really like. This one's another one. What's going on in this picture? What do you see that makes you say that? This one has so much to see. And what more can we find? This one similarly. What's going on in this picture? What do you see that makes you say that? What more can we find? These are examples of actual art in museums. And actually, the picture here it was in the Ackland on the second floor. I'm not sure if it still is, this one. Um, okay, before we close and get to some questions and answers, I want to take you through one other art museum based practice. And it's called the Personal Response Tour, another way to enhance understanding within teams, help people get to know each other better, enhance communication and appreciation, really, for other people's experiences. So, in the Personal Response Tour is really fun. You're in the museum, or you can do it online. If you're in the museum, the facilitator will have a basket, and they'll have little cards like you see on the image to the left of prompts, and the participants will pull a prompt from the basket and they'll be in a particular gallery and they're asked to find an image that resonates with them based on the prompt. And then they share that with their colleagues in the group. So the prompts are used to enhance art-based reflective practices. And we've done this with students and colleagues at the Ackland Museum. So my colleagues here on the call co-facilitating with me, can you please place the link in the chat from Ackland? And we're going to ask people to open that link, and I'm going to give you all instructions for practicing the response tour. Thank you so much. So if you're still with us, if you all can click on the link that Mohammed and Sarah shared. Thanks, Mohammed and Sarah. And it should take you to an image of pottery dishes and the Ackland. And before I share my screen to go there, I'm going to give you some instructions for the personal response tour. So for personal response tour, you visit the gallery and select a work of art that resonates with the following prompt. And so the prompt can be designed very specifically to generate, whatever the topic of the day is for your group. So for us, let's start with this prompt. Find a work of art that brings you a sense of comfort or calm. And that work of art will be one of those pottery pieces. As you select the piece of art that brings you a sense of comfort or calm, just notice what's coming up for you. So you're going to look at the different pieces of pottery and you're not going to think about it too long. You don't want to overly think. You probably are drawn to one piece or another just immediately. So that one that you were drawn to, And then for you internally, take a few moments to notice what's coming up for you with that particular piece of pottery. And then maybe somebody's willing to share in the chat which piece came up for you. So I'm gonna catch up with you all and go to the gallery myself. So when you click on it, it first comes up with that beautiful blue, red, and white plate. But then if you scroll down, you'll see other options. So let me see if I can stop sharing my screen so we can be looking at it together. Okay. So you could choose the one on top or any of the ones below. And then when you click, it'll make the one bigger if you choose. Or you can just go to the view. And then once you click one, some additional ones come up. So this is one to show you that it doesn't have to just be images of people or photographs or paintings that you use art museum based practices. It can be sculpture or pottery. And so is anyone willing to share? You can put the name of it or the description of it in the chat. Which piece of pottery resonates most with you in terms of bringing a sense of comfort or calm? And this can be private too. You don't have to share. But if you're willing to share, you can put it in the chat. In general, art museum based practice is meant to be collaborative and to share. But when we're on a Zoom like this with people that we don't know, we haven't kind of oriented ourselves with one another yet, it's natural to also want to keep it private. And so just for the sake of time, someone can still type, but I practiced with my husband earlier before this presentation, and I said, which piece of art brings you a sense of comfort or calm? And he picked out this green piece, right? And then I could ask him more like, what about that brought you a sense of comfort or calm? Can you say more about your experience with this piece? And he talked about the color, the shape, um, the fact that it was a bowl shaped like a bowl and how it just, brought calm to him. And so then we go on to the next person. I'd say there's a person in our group named Laura, and I'd say, okay, I might say, Laura, which one resonated with you? Or I would say, is there anyone else who also chose this green bowl? And then you may have someone who chose the green bowl, and then we ask them what about it brought them comfort or calm. So then there's similarity in choosing the green bowl, but there's distinction in why it resonated. Then someone may say, well, I chose this splashware bowl here because it reminds me of the colors of my grandmother's house, whatever. And so when people are willing to share a bit and be vulnerable, then it helps their team members know more about them than they're the person to go to for procurement, for example. Like we know each other in our roles at work. Like this person is the person who helps with travel. This person's the person who helps with, student affairs, but there's more to us, and the more we know each other, the more we relate to each other in real human ways. So I appreciate Sarah's comment because this is a good time for us to start, asking questions or comments about the session. As you all are considering doing that, I want to share with you other types of prompts that you could even consider. So the first one talked about what's the art that brings you calm or comfort? If you want to go a little bit more deep, you could say, find an art that reminds you of your childhood. And then the person might say one of these and why, or find a work of art that represents how you approach completing tasks. Because maybe it's a team that works together, and we need to understand how each person approaches tasks so we can understand how to work best with them. And so then learning about that would be a neat way to do it through art. Um, have even been, for those of us who may be faculty on the call, um, you can use course syllabi or even course maps or other documents that you share with students to do VTS with, because we assume the way we communicate in images or writing makes sense. But when you invite other people to give critique in an art museum based approach, you can find out that you might be communicating in ways that you didn't intend to do. So, as we give you all an opportunity to maybe ask questions or give comments about the session, here are just some other images that could be used for personal response tour. Again, you usually choose images that don't have a clear message. It's kind of abstract in a way, which gives people an opportunity to bring their own experiences, their own perspectives to engaging with that image. And you can choose prompts. So we can ask ourselves, how might these activities foster well-being? How might they foster team building? Number one, some of us might feel a lot calmer now than we did when we came, just because we've been able to keep our mind from focusing on 10 things at once. We're focusing on the art, so that parasympathetic nervous system has been activated. But what we know through research, art museum-based approaches encourage us to slow down and notice what matters to ourselves and to others. They help promote self-awareness and reflection. We also know that sharing personal and professional stories help us connect with ourselves and one another, and is shown to help people feel less isolated. Art can um, promotes a reflective practice to process professional experiences. So it's less direct than saying, what's going on? What was wrong with that situation that happened? You can use art as a prompt to process experiences. Art provides space to consider our core values and our sense of purpose. And it also provides opportunities to find nourishment in beauty. So we know that being able to express ourselves emotionally is associated with stronger immune functioning. It enhances our parasympathetic activity that promotes cardiovascular and neuroendocrine health. These art-based practices can help support emotional regulation. And but we know that barriers and challenges can alter people's sense of safety in expressing themselves emotionally. So we just need to be aware of that when we engage in art-based practices. And I'll conclude by saying that art can be thought of very globally. Beyond visual arts, you can use music, journaling, exercise, nature, to engage in these types of mindfulness-based experiences. Art-based experiences can help us transform our work environment, which is important for mental health and well-being because we know we spend so many hours at work. In the Office of Well-being in the School of Nursing, our goal is to create a culture of well-being. We're not perfect, we're not there yet, but we work on that every day. Um, Mindfulness can, as I mentioned before, enhance a sense of belongingness, give us space. You can see this last bullet. This practice or the practices we did today can give us more space and wherewithal to identify root causes to chronic challenges, versus applying superficial short-term band-aids. We can be more critical in our approaches to addressing and resolving problems that seem to be relentless. Um, What keeps us from doing these things that are accessible? If you recall from that very first image of lavender, you all mentioned just after seconds of engaging with that image of lavender that it made you feel calmer, peaceful, all these things. So, what can you do right now in your workspace to create a sense of that? Is there art you need to bring into your artwork space? Are there plants? Are there images that by looking at them and pausing will give you that sense of peace and calmness? I see something. I don't know if it's a chat. Let's see. Oh, a Q&A. Okay. The techniques you shared, such as VTS and the personal response tour, seem to be designed for use with teams, groups of people, which I know is the purpose of this talk. But can they be used in individual mindfulness practice as well? Absolutely, they can be. You can do this with images on your computer. You can go to the museum. There are lots of spaces, even here at UNC Chapel Hill, that have art. The student union, the halls of the student union have art on the walls. The cancer hospital, the business school. It could even be with nature, where you're allowing yourself time to engage in activities that allow you to slow down and be more observant and ask yourself those questions. What's going on in this image? What do I see that makes me say that? Um, but of course, as you mentioned, the team approach also helps us to expand our awareness when we get feedback from others. So that's a great question, but absolutely. I find myself looking, I was at a restaurant in Chapel Hill recently, and there was a piece of art on the wall, and I couldn't help but bring the VTS questions to that piece of art within myself as I was looking at it. Okay. So we're going to end the Zoom, and I think it's time for us to just close so everybody can get to their 1:30. I think we're going to get some remarks from Amy Johnson to close us out, but I just want to end with some resources. These are books on mindfulness at work, happiness at work, mindful leadership. And I'll end with this quote: to lead effectively, which we all lead in some ways, you must be at peace with yourself. You must know yourself. You must listen to your inner voice. You lessen yourself when you retreat from the core of who you are. So thank you so much. I really appreciate the time to be with you today.
Everybody, please help me in thanking Dr. Cheryl Woods-Giscombe for her wonderful presentation today and leading us through, I hope, some strategies. I particularly, one of the things that I love about this, aside from just the concept of VTS, which I think is a practice that we can engage with so many things, I also appreciate, I was just having a conversation with a friend the other day who was talking about how he didn't really like to go to museums because he feels intimidated, like he can't access. And I think this sort of concept helps make this more accessible and reinforces that there is not a particular thing that if you are somehow, particularly skilled or intelligent or cultured, that you should see, that it is about what we observe and continue to ask ourselves and prompt sort of, why is it that I observe that? What more do I see? I especially love from learning and seeing other people's observations about the same piece of work that I was looking at that I didn't connect with. So Cheryl, thank you so much for this today. I really appreciate it and grateful for all of your expertise and leadership here at Carolina. It's just a real pleasure. Thank you. Thank you.
Thank you for having me.
Oh, we are grateful. Be careful. We'll invite you again. So now, folks, we'll wrap up because I agree. We want to make sure that you get onto your 1:30. A couple of quick housekeeping items. We are offering CLE credit for this particular program. So there is the QR code right there. Please feel free to click on that and ensure that you get credit. We will also have another mental health seminar coming up in November, which is about everyday connections for mental health with Dr. Edwin Fisher and Patrick Tang. So we are looking forward to that session. Please mark your calendars and join us. And then also we are going to record, or we're going to download the recording today and have the transcript and information up on our Heals Care Network website, which is care.unc.edu, as you can see on your screen right now. If you want to show this to someone else or something particularly resonated with you and you want to come back to it, please understand that you can come back and again take advantage of the conversation that we've had here today and the information that Dr. Woodsky-Scumbe has shared with us. So thank you, everyone. Have a wonderful rest of your Thursday. Thank you also to our behind-the-scenes experts, Sarah Stallman and Mohammed Al-Obaidi, for all of your work to make this go and make it look seamless and easy. We know it is not, so we are grateful to you, and we're grateful to everyone joining us today. We look forward to seeing you at a future session. Take care, everyone.